Hi, my name is Carolyn Cole. I'm a licensed clinical professional counselor located in Chicago. Some of the areas of specialty that I work with are working with individuals who struggle with depression, anxiety, and relationship issues. If you would be interested in contacting me to work on some of those areas, please feel free to reach out. When coming to the first session, I feel my job is to make you feel as comfortable as possible because I fully understand it can be really scary to be coming to see a therapist for the first time. The first session is going to be a little bit different than the ongoing sessions because it's more of an assessment session. You can compare it to when you go to a doctor if you've broken a bone, for example. He's not going to go in and just start to perform surgery on the bone without doing an x-ray, taking labs, perhaps doing some other testing first, because he really wants to assess what's really the problem, what's really going on, and what's the best way that I can help to fix the problem. And so that's what my job will be during our first session together, to get to know you, who makes you who you are today. So we'll be talking about some of your past history in terms of your family, your childhood, how you've dealt with different problems, some of your strengths and struggles, and of course, what your presenting issue is. In terms of my clinical approach, I'm not really following one theoretical orientation. I use a more integrative approach to be able to help you meet the goals that you have. And so it's going to be different for each client. I became a therapist because I found that I really like talking to people, getting to know them on a deeper level, almost from the inside out. I really enjoy helping people identify goals that they want to lead a more fulfilled and happy life and to be part of that journey and helping my client to be able to achieve that. When choosing a therapist, the most important thing is going to be how comfortable you feel with that therapist. If you're not comfortable, you're going to be hesitant to share any of the innermost feelings and thoughts that you're having, which is really going to interfere with any of the progress that you can make. So it's really important to choose somebody that you feel hears you, understands you, and that you feel very comfortable with. I believe that my personal experiences have helped me to become a better therapist. I understand how scary it can be to come in to see a therapist and to really share some of these very personal things about yourself. And so I feel like my job is to be able to connect with you and help you feel safe as we go through this process together. Many people come in asking how frequently or for how long somebody should be coming into therapy, and that really differs per person. However, at the beginning, I highly recommend the importance of coming to weekly sessions. This is a chance for us to really get to know one another, to build that rapport, and really get a good head start on tackling that problem that you're coming in that you're looking for assistance with. Then, as you're starting to feel better, there's an opportunity down the road to be able to tailor back on therapy. That's Therapy isn't just about the hour that we spend together. It's going to be how you're applying the information that we talk about in your own world outside of our sessions. And so how much work you put in towards that is also going to make a difference in how long you might have to come to therapy for. But what I have found is that my clients know when they're ready to be done with therapy. The best part of being a therapist for me is to be able to watch my clients grow, to watch the hard work that they're putting in, and to see the excitement that they feel when they're able to achieve the results that they were looking for when initially coming in for therapy.